Hey, this is Dr. John Mark here. I'm a licensed physical therapist, owner of Simply Physio, and the Pickleball Physio. We are documenting a case of a client of ours who has just had a stem cell therapy treatment for a knee issue. So she had a medial and lateral meniscus tear, and so she's coming in later today, actually, for her first appointment. But I want to share a little bit about the protocol that we got from the doctor and just kind of explain how we look at this and some other things that she'll be using in her recovery back to the pickleball court. As you can see here, this is the what we call like a protocol, and most protocols they give us guidelines. They won't tell us specifically what to do. They leave that up to us. And also, the individual is going to have some differences on just how fast they recover based off of just their previous experience, their health, their strength, what condition they were in before having the treatment. She is coming in 3 days after her stem cell therapy treatment. So she's kind of right in between phase 1 and 2. So one thing that we'll be looking for today, one is the restrictions. So she has instructions to be wearing an unloader brace while weight bearing. So while she's on her feet for 6 weeks. So I want to show you here is just what an unloader brace is. You can see it is for OA, which is osteoarthritis, arthritis pain, osteoarthritis pain, bone on bone, knee joint, medial or lateral. So the nice thing about a brace like this is it is adjustable, and you have to buy one for either the left or the right. So it's depending on which side you have involvement, you make sure you get that the correct size, because it's meant to be one-sided. And here's how it shows just some of the adjustment pieces to it. You can adjust the hinge to relieve pressure on either the medial or lateral parts. So for our client, since she had tears on both sides, we'll have to just make some adjustments and see what ultimately feels the best for her, since it was involvement on both sides. But so that's where you would make the adjustments to just the angle of brace, so it's taking some pressure off. A few other pictures here. What we got going on. All right, so yeah, that's the knee unloader brace. If we go back here to the protocol, so the instructions to wear that for the first 6 weeks. The rationale behind this is after they've injected the stem cell into the knee, that they want it to take and for it to do its thing, and they don't want too much stirring up of pressure around the knee. So that's kind of the theory or the explanation, around the brace. At some point, we'll want to start loading the knee, because we know the cartilage and bone health is dependent on increasing its tolerance to load. So there'll be a transition through treatment, and we'll be talking with her physician, more specifically. But right now, we have to take it for what we have. Is she'll be wearing the brace for 6 weeks, and in essence, we don't want to be putting too much load on the knee itself. So want to show here. So this is what we're going to be looking at today. Since she is right at 3 days, she has this progressed to the next phase when she's able to perform range of motion exercises with no more than 2 out of 10 pain. So if she can do that today, then we're looking at progressing her into some more resistance training. Not resistance training, but core training and other hip and knee strengthening. So non-resistance, so we're not using weights, we're not using bands, we're just using body weight. But in the brace, and making sure that really throughout her phases that we're looking to be within the not going above 2 out of 10 pain. So you can see that she needs to be able to walk for exercise with no more than 2 out of 10 pain for 1 week before she's going on to this phase. And I expect her to be in this phase number 2 from 4 days out to approximately 2 weeks out. And these are some other activities at this stage. if non-painful. So she can start, some walking, elliptical, swimming, biking, even some yoga, but again, with the knee brace. So the other thing I wanted to show a picture of that they recommended too was infrared heating. So we talked about heat in another video, heat versus ice for inflammation. So I won't go into those details. You can check out that video if you want more. But part of the protocol that I had her go ahead and order was this specific knee infrared brace. So I'll put some links to both these products in the comments in the description. But this is a specific one that I recommended for her. So what her instructions are to weigh theirs for up to around 30 minutes a day to help facilitate and encourage the healing process of taking her through the inflammatory process so that the healing nature occurs around the knee. So the heat infrared is meant to deliver just a bit more of a deeper heat. We'll see what they say here. They really talk much about infrared, which deeply and evenly penetrates throughout the body. So the advantage of this over just a heating pad is it's designed to facilitate a deeper heat than just a hot pack would. And you can see here bringing relief by increasing circulation. So that's what the doctor really wants, is to increase circulation to help with the healing process. And so he recommends using heat instead of ice, what we'll be doing. So stay tuned. We'll be continuing to document her process, and we'll actually shoot another video as her first appointment into the clinic today. So we'll get a live action footage of what her knee looks like and how it's moving. So stay tuned. Thanks, guys.